Hello, everyone. So glad that you are here with us. Welcome to Counseling 581. Today we will get started with Module 1, Foundations of Wellness Counseling, from our text, Wellness Counseling, a Holistic Approach to Prevention and Intervention. My name is Tara Aller. I'm one of your co-instructors, along with Jenna Lee Ofstedal. I will be completing Modules 1 and 3 with you all, while Jenna Lee will be completing Modules 2 and 4. We will both be with you all for our Friday Zoom sessions. Before we get started with the student learning outcomes, I would like to take a quick moment to review some considerations from the Moodle site. You may have already noticed that the entire PowerPoint for Module 1 is posted, and it includes content from chapters 1 through 3. Additionally, there are 3 recordings posted for Module 1. This initial recording, and then another recording for Chapter 2, and a recording for Chapter 3. You may have also noticed that there is a Module 1 worksheet. If you haven't had a chance to download or review the Module 1 worksheet, go ahead and pause this recording, download that worksheet so that you can follow along throughout this module. Now that we've had some time to review the Moodle site for Module 1, and everybody has their worksheet handy, we're going to get started with the student learning outcomes. By the end of Module 1, students will be able to define wellness counseling, identify and describe key historical influences of wellness counseling, identify and describe trends in wellness counseling, and integrate their definition of wellness counseling with their professional identity. As we take a look at the overview for this first module, we see that we'll first start with Chapter 1, an introduction to wellness counseling. We will then move on to Chapter 2, history and background of wellness counseling, and we will end with Chapter 3, trends in health and wellness. Introduction. When one tugs at a single thing in nature, he finds it attached to the rest of the world. I intentionally included the quotes from these sections as I found them to be very relevant, and I thought the authors did a remarkable job at picking accurate quotes to describe the content to come. This quote in particular resonated with me as it highlights the interconnectedness of wellness. The value of wellness. What does wellness mean to you? At this time, I'd like to pause so that you can refer back to your Module 1 worksheet. The initial question on the worksheet is, what does wellness mean to me? Take a few moments to consider this question and jot down some notes about what wellness means to you. Wellness is embedded in the counseling profession. Wellness allows for an integrated and holistic perspective. Focusing on wellness may shift stigma as individuals may be more comfortable with maintaining wellness and having that be a key focus of counseling versus a more problem-focused approach. Our Code of Ethics emphasizes the importance for counselor self-care and counselor wellness in order to support ethical practice and best serve our clients. This is so important for us to note and consider. As counselors, if we are not maintaining our own wellness, we are putting ourselves at risk for unethical practice. The following is a definition of wellness from our text on page 5. Myers, Sweeney, and Whitmer define wellness as a way of life oriented toward optimal health and well-being, in which the body, mind, and spirit are integrated by the individual to live life more fully within the human and natural community. As you consider this definition and your notes from earlier about what wellness means to you, how would you now define wellness counseling, and how might you describe this to your clients? Go ahead and take another moment to take some notes on the Module 1 worksheet. We are now going to talk a little bit about stress. Wellness counseling is so important because of the high rates of reported stress among individuals. 1 in 4 individuals rate their level of stress as an 8 on a scale of 1 to 10, according to a 2016 APA survey. Additionally, caregivers of youth report that youth also have high levels of stress. The La Crosse County Youth Risk Behavior Survey would support this data at a local level. The 2017 survey results indicated that 30% of high school students felt sad or hopeless every day for the last 2 weeks, with an additional 15% considering suicide. In addition to adults and adolescents reporting high levels of stress and mental health concerns, rates of mental health disorders co-occurring with chronic illness are also high. You can refer back to our text on page 6 and 7 for statistics related to rates of hypertension and diabetes, along with mental health disorders. These high rates and prevalence of stress and chronic illness support the need for counselors skilled in wellness approaches. Counselors who are skilled in wellness approaches know that there is an interconnected relationship between the mind and body, and that mental health and physical health are interconnected. When we support somebody's mental health, we're also supporting their physical health, and vice versa. In addition to stress reported by individuals and youth, it is also important to note that counseling itself can be a hazardous profession. Some sources of stress for counselors are feeling they are not helping their clients, the tendency to accept full responsibility for a client's progress, feeling a pressure to quickly solve the problems of clients, or having extremely high personal goals and perfectionist strivings. Impaired counselors have less ability to resolve stressful events and are not able to function professionally. This refers back to the importance of our ACA Code of Ethics. Impaired counselors may be more likely to professionally isolate themselves, feel a need to rescue clients, feel a need for constant reassurance about one's abilities, engage in unhelpful substance use, jump to premature problem solving, desire taking away all pain from clients in order to soothe our own discomfort. Counselors who have an understanding of the importance of our own wellness will be able to best combat some of these occurrences. We will revisit this when we talk about compassion fatigue and burnout later in this module. Another reason why it is so important for counselors to be skilled in wellness approaches is because of the integration of wellness programs in the workplace and school settings. Many workplaces are integrating wellness programs and screenings to best support their employees, which also has benefit for the employer. Additionally, schools are targeting wellness as a way to better support students, noting that student stress is high and rates of mental health disorders are increasing for adolescents. It is increasingly common for medical and mental health professionals to be working collaboratively in integrated care settings. Wellness counseling provides a great framework as it offers a holistic approach, noting the connectedness of physical and mental health. As we continue to look at the value of wellness, we will briefly look at the warning signs of stress from Dr. Ward. Dr. Ward broke the warning signs of stress into 4 categories: physical, behavioral, emotional, and cognitive. If you refer back to your Module 1 worksheet, you will see the full symptoms listed for each of the 4 categories. Take a moment to reflect upon which symptoms are present for you during times of stress. Now that you have acknowledged this, how can you take notice and put energy into your wellness? During my master's program, this activity was an important shift for me. It was important for me to acknowledge and notice that when I experience tension in my shoulders and my neck and edginess and have less ability to tolerate small stressors, those are all key indicators of my stress level. As I was able to notice and name those things, I'm now more readily able to implement wellness strategies in order to manage my stress. We will now move on to wellness counseling and goal setting. Our text refers to utilizing the wellness platform as a starting point for exploring goal setting and strengths with clients. It is easy for counselors to experience cognitive constriction when clients present many different stressors or presenting concerns. Sometimes this may be experienced as feeling overwhelmed or being lost at sea and not knowing quite where to begin. Strengths can be an anchor. They can be the groundwork. It can also be empowering to both the client and the counselor, making it more readily available for us to send messages of hope. These messages of hope are so important. What some of you may know already about common factors research is that 15% of the outcomes related to counseling are related to the expectations. Another way of thinking about expectations is thinking about hope. Additionally, 15% is related to the therapeutic technique that the counselor implements, 30% is related to the therapeutic relationship, and 40% of the outcomes are related to outside factors. We can also think about the outside factors as the client's strengths and stressors, anything that happens outside of the counseling relationship or outside of the counseling session. If we can affect change on hope and acknowledging and enhancing strengths, we're hitting quite a few of these common factors. Wellness counseling is a useful framework when working with all clients. As we've been talking about, it allows for a broadening. The text gives an example about when you might be working with a new client and when that client is not quite sure about what they would like to set as their goals. A useful strategy may be to pull out a wellness model or a wellness wheel and identify where are their strengths and where are their struggles. And this will start allowing us to do some goal setting and treatment planning. This conversation may also allow us to shift away from the presenting concerns and the struggles and focus more on the client's strengths, which will, as we talked about earlier, increase that sense of hope. The value of wellness continued. Wellness counseling is applicable across the lifespan and across presenting concerns. More than 1 in 5 children have experienced 2 or more adverse childhood experiences, or ACEs. Some examples of adverse childhood experiences include divorce, witnessing domestic violence, incarcerated parent, or substance use in the family. These experiences have a ripple effect both on mental and physical health. A focus on wellness can help build resiliency despite facing this adversity. We'll come back to more conversations about resiliency later in this module, but also throughout this course. Our text talks about some specific examples of how wellness might be useful when working with adolescents. Some areas of focus might be looking at self-esteem, social skills, or mindfulness. Additionally, the authors refer to wellness in older adults. It might be helpful to explore substance use or to use wellness as a framework to prevent exacerbation of mental or physical health concerns. Additionally, wellness counseling is applicable across presenting concerns. It can be used as a framework for prevention or intervention. It's useful because it highlights the strengths, areas for improvement, and is a proactive approach as to how to tackle future stressors. It also provides environmental and integrated context. A common theme we see throughout this chapter includes wellness counseling being versatile and holistic in nature. Wellness counseling is trans-theoretical. This means that wellness counseling is a useful framework for treatment planning across therapeutic interventions. For example, we can utilize the wellness counseling framework for discussing treatment planning with the client, and we can implement other therapeutic interventions such as CBT strategies or another relevant therapeutic approach. Wellness counseling also supports what we know to be true about the process of change. It considers the level of importance, the level of confidence, and the client's readiness for change. This allows the counselor and the client to focus on what will be most relevant for the client and to provide the greatest amount of change possible. This is our final slide on the value of wellness. Wellness is for counselors too. As we have been talking about throughout this module, counselor wellness is so important to our ethical practice. Learning about wellness counseling provides us a context to consider our own wellness as counselors and how to best support our wellness throughout our career. Earlier in this module, we spoke about warning signs of stress. These will be so important to consider in order to combat compassion fatigue and burnout. Before completing this recording, I'd like you to consider how you might combat these threats of compassion fatigue and burnout. It might be useful to take a look at the personal wellness plan template. This may be something that will be useful for you to consider as you move forward, even beyond this class and into your work as a counselor. Our text also emphasizes the importance of utilizing a holistic approach and considering mindfulness as we contemplate our own wellness. I'll be back with you real soon with the recording for Chapter 2 and then the recording for Chapter 3.